Patients who seek medical attention from medical facilities under the Rural and Urban Private Hospitals Association of Kenya, that is RUPHA, will be required to pay cash to access services effective January 1st. The private hospitals maintain that the government has remained non-committal on the payment of about 29 billion shillings owed to them by the now-defunct National Health Insurance Fund, that is NHIF. They also say that the government has reduced capitation amounts under the Social Health Authority, leaving hospitals struggling to meet operational costs. Safin Achieng Ouma with the details.
Social Health Authority healthcare funding model remains under sharp scrutiny amidst a growing concern over its impact on cost and timely access to healthcare. Rural and Urban Private Hospitals Association of Kenya, RUPHA, has accused the government of being non-committal on the payment of about 29 billion shillings owed to them by the now-defunct National Health Insurance Fund.
Unless there is substantial move to settle NHIF liabilities, from 1st of January, we will move to out-of-pocket payment. We have no other way. How do we keep the facilities open? You cannot have 3/4 of hospitals that have not paid their workers for the last 3 months and expect that healthcare will be normal.
RUPHA also claims that the financial burden on patients and facilities has increased since the launch of SHA, citing limited reimbursements for outpatient services and rising costs for ICU and HDU.
Why is it that now the reimbursement for outpatient visit is 75 shillings per Kenyan per month? How is it possible that you can provide X-ray, ultrasound, laboratory tests within just 75 shillings per month? This is not the promise that we gave the Kenyan people. And they are telling us, because hospitals are unable to provide care under those terms, Kenyans are telling us that out-of-pocket expenditure is rising.
The latest circular issued by the Ministry of Health confirmed that SHA's coverage is based on tariffs that were gazetted in November 2024, which had indicated that SHA will pay for patients in ICU and HDU up to 3,360 per day for Level 4 facilities, 3,920 per day for Level 5 facilities, and 4,480 per day for Level 6 facilities, with patients required to top up any amount that exceeds the cover limit. RUPHA's chairperson Brian Lishenga termed this a mismatch in the initial promise by the government and a slap in the face of many Kenyans who, despite the increased contributions, will be forced to make out-of-pocket payments.
Today, we have Kenyans who are being paid only 10% of an ICU bill. And we have statements coming out saying that ICU is only rebate. Now, if you are collecting more money, because of 2.75%, why is it that we are not getting more benefits?
There are concerns coming even as members of the Kenya Union of Clinical Officers protested their exclusion from SHA empanelment. The union accused the SHA board of deliberately excluding clinical officers and their facilities from the contracting and pre-authorization procedures under the scheme.
Pediatric services, reproductive health, ENT, ophthalmology, all the services, we are the one who are leading. When you have hastily decide kwamba hawa hawatafanya kazi, watapitia kwa mtu mwingine kinyume na sheria. Tunasema sababu yako ni kwa ajili ya kujibinafsisha na kuendelesha wizi wa mali ya umma kinyume na sheria.
KUKO has also called on President William Ruto to disband the SHA board and reconstitute it with individuals who understand the mission and vision of the universal health coverage. Safin Achieng Ouma, Citizen TV.